Hi, everyone. I'm Dr. Marie Schambach, and I'm honored to chair this year's WISHRS session at the ISHRS World Congress in Berlin. This year's theme is Heritage and Heritage. I know it sounds similar, but it's quite different. And we're inviting every woman in hair surgery to show up boldly, proudly, and yes, dressed in marigold, a color that
Woohoo!
celebrates resilience, optimism, and feminine strength. But WISHRS isn't just a dress code. It's a space to grow, connect, and challenge how we practice surgery as women. And there is no better way to kick off this year's program than with our keynote speaker, the remarkable Wonder Woman, Dr. Gorana Kuka. Her talk on that will change how you think about medicine, your body, and your patients. Listen to this. Women are not small men. Harmonizing women's health across the 28-day cycle and the 7 decades. Let's dive into this. Gorana, your title is already a revolution. Can you tell us what inspired this talk and why it's such a critical message for women physicians to hear right now?
Hi, Maria. So nice to see you, and thank you for the invite to do this, which I think it's really important talk for us as female surgeon. So we are able to create a safe space within this male profession, traditionally considered male profession, and just to acknowledge we are not the small men. We are women, and our biology is different. Our mind body axis is different than men. And also to honor our cycles, that we have different cycles. We have a 28-day cycle, which men don't. They have 24-hour cycle. And we just thrive differently in different decades of our life. And what inspired me, I guess it will be my female patients, and that me as a doctor need to serve as a support through what they're going through in their lives. And there is like typical decades, like if I see a teenager, yes, there is hair loss, but there is also hormonal shifts in puberty. There could be some bullying in school. Like, is there anything socially that these kids, this girl is going through? Then if I see a woman in her 20s, how is she dealing with, completion of studies, entering professional life, maybe meeting her future partner? Then 30s, when you become a mother, how are you dealing with post-pregnancy, taking care of children? Then in 40s, what adds up is like caring about an older and sick parent that adds up onto your load. And then there is perimenopause, getting back to ourselves, figuring what we missed while we were taking care of everyone else in our life, and that we actually need to return to ourselves, to who we are, how we're going to live the rest of our life. And I want to take care of my patients, but I also want to take care of myself. So I think that all came into this presentation, which I hope you are going to enjoy, and everyone else who attends is really going to learn, maybe to be better to ourselves and take better care of ourselves.
I completely agree, and you are quite an example to achieve all that. Now, you explain how the 28-day hormonal cycle affects metabolism, brain function, even emotional resilience, and that's the slow pace change because that's a 28-day cycle.
Yeah.
And yet, medicine often ignores it completely. And
Yeah.
how can understanding this rhythm can transform both patient care, but especially physician self-care?
Yeah. I mean, I want to tell you, we're not just physicians, we're entrepreneurs. If you're in private practice, as you are, you're dealing with probably 50% of load, which is not medical, right? And then actually, I've learned it the harder way. A couple of years ago, I started fasting, and I thought fasting is the best thing. My I was doing so great. I lost some weight. I had a lot of energy. My hormones were fine until they were not, which I've learned a couple of months later that there are periods of our month when we cannot push our body into stress, and fasting is a form of stress. So that's why we have this three elements, or four, some doctors claim four parts of cycle, of 28-day cycle. There is follicular phase, there is ovulatory phase, there is luteal phase, and menstrual phase, which can be a part of follicular phase. And not just they determine our biology, they determine how we can work better. Like, for example, in a follicular phase, we can be more creative, we can set intention, we can research what we want to do. We can brainstorm with colleagues. Then ovulatory phase, it's a better time to socialize, to pitch ideas with, to collaborate. And then luteal is just like, go, like, don't procrastinate, just be efficient, and so forth. And I actually started mapping my cycle and like how I'm going to work related to my hormones, because they run us. I mean, whether we like it or not, they run our brain chemistry, they run our gut chemistry. And once we decide to match our biology, everything else becomes easier, truly.
Do you think we should like change or modify our daily consultation with our female patient by asking their what type of cycle they are, or modify treatment in terms of specifically those 28-day cycle?
I'll tell you one thing that was curious to me. Remember how when we do hormone testing, we tell our patients, okay, your hormones you're going to do on the second or third day of cycle, you know, your estrogen, progesterone, testosterone, you know, you want them on second or third day of cycle. So it's convenient for patients to do all their labs on that day, right? They do vitamin D, they do iron, they do ferritin, etc. But if you think third day of cycle, they're bleeding and they're losing blood, meaning their iron is going to be at their lowest during the 28-day cycle. And we rely that that's their iron, which it might not be in the other parts of the cycle. So that for me is a valuable information. Like, it is, I don't think that iron on the third day of the cycle is going to be the same as 10-day of cycle.
Of course. Wow. Well, for us as hair surgeons, and obviously I'm going to ask this because it relates closer to my age, especially those treating perimenopausal or menopausal patients, what are some key insights that we need to bring into the consult room? Like, we need some key tips that we want to cover and make sure that we've all covered.
Yes, I think once we're entering the perimenopause period, which is when the cycle starts to fluctuate, when there are symptoms, etc., I want to bring in the room other two hormonal systems, that's thyroid and adrenals. And many of these symptoms stem from other hormonal systems because it's all interconnected. And I think I've seen it with my patients, those with no thyroid disease, they're not under high stress, they sort of go through menopause, through perimenopause with fewer symptoms, and vice versa. So I want to emphasize also stress and build resilience for like mental clarity and stress management, etc. Not just like, okay, let's modify estrogen and progesterone. Yes, we can do that, but there are these other two systems also run the show of symptoms of perimenopause. So that's what I would like, that it's taking into that equation of minimizing symptoms in perimenopause.
Your talk feels like both, a medical update and a love letter to women. It's going to be amazing. So what's the one thing you hope every woman leaves your session feeling or knowing about her body and her power?
Exactly what you said, just to bring power back to our female colleagues, just for them, because we are giving nature per nature. Our nature is giving, and we also give to everyone around us. We give to our patients. I want that we give more to ourselves. And if there is one thing that this whole talk is gonna institute in them, that's like, go back to yourself and start giving yourself more.
Thank you so much. Gorana's talk is just one of the many reasons to join the WISHRS, especially now in Berlin. This year, we've created a space that's not only about surgical skills, it's about building confidence, visibility, and sisterhood in the field where women still have to work harder to be heard and to be paid attention to. You will be able to connect through Speed Mentoring Carousel, which I won't go into details very much, but there's something that we've been trying to work very hard to get female mentorships. That's going to be easier, and not only for expertise to newbies, but like I would love to be, mentored by Gorana in this all new holistic system. And if I could spend some time with her and try to absorb as much as I could to improve not only my life as a patient, but to someone else. So you will get a chance to search that mentorship or be a mentor or a mentee. That would be great. We'll be laughing a lot and learning in a session that we will have called Truth from the Hair Chair panel. So I won't go into details, but just look forward for that. And yes, wear marigold. I know it's so hard, but it's about being visible, being bold, being part of the movement. Because
And
as
shining your light.
Gorana reminds us, yeah, and as Gorana reminds us, we are not small men. We're not afterthoughts. We are powerful, cyclical, intentional women, and together we're transforming hair surgery on our terms. So we can't wait to see you all in Berlin, and let's make this a movement, not just a meeting. Thank you so much, Gorana.
Thank you, Marie. We'll see you soon.
See you all.